Good morning, guys. Tony Maritato here, licensed physical therapist, and in today's video I want to share 8 reasons why you feel so tired, you get so tired so quickly after your total knee or total hip replacement. Now, I was in the clinic this morning. Today is November 28th, 2022, and I saw 2 new patients following total knee replacement surgery. One was about a month out, one was about 7 days out from surgery. And both of them really were saying the same thing. You know, they said, why am I getting so tired? This looks like it should be so easy. Before surgery, I was able to do these things. Now I'm just wiped out. I go home, I take a nap, I wake up, I feel like I can barely get even a load of laundry done before I'm out of breath and tired again. So there are 8, probably more, things that are going to affect how tired you get and how quickly you fatigue. So number 1 is simply your inability to sleep. I don't know that I've seen a single patient in 20 plus years who have had a total knee or a total hip replacement who tell me, oh my goodness, I sleep like a baby the day after surgery. Most patients are struggling to sleep 2, 4, 6 weeks after surgery. They're struggling to find a comfortable position. The pain increases, the swelling, the throbbing, the aching. Some people are so sensitive over the incision they can barely stand to have anything touching their skin. So improper or impaired sleep, super common, and it's one of those things that will lead to rapid onset fatigue during the day. The second reason is dietary changes. You know, often the pain medication leads to constipation, then you take something to loosen the stool, and then you have diarrhea. It's this constant balance back and forth. You're not eating your normal diet. You might have depressed appetite. You're just not feeling good. You don't have the energy and the pep, and with that, you get tired quickly. So as your nutritional profile improves, as you start to eat more regularly and your bathroom habits normalize, you should see a return to normal energy levels. But that could be 2 weeks, that could be 6 weeks, that could be even 6 months for some individuals. So pain is a huge element. People fatigue rapidly when they're in pain. Pain is a constant drain. Pain increases your stress hormones. Pain makes sleeping difficult. It decreases your appetite. Pain is going to have a major influence on your energy levels. So if you don't feel like you have adequate pain control, if you're not managing the pain well, talk to your surgical team. Sometimes one pain medication for one person is not the right pain medication for another. And often a little change to some of your medication, either timing or the type of medication, which will only be prescribed by your surgical team, might have a dramatic impact on how you manage pain, which will improve your energy levels. So of course, there is a price to pay for healing, right? The trauma of surgery itself, the trauma of the osteoarthritis that you've had leading up to the surgery. All of this requires your body to go through a massive healing process. A total knee replacement, a total hip replacement, these are major surgical procedures. You will need rest and recovery as part of the healing process. Plus, after surgery, the reality is you're probably doing more physical therapy than you've done in months, simply because it's the expectation of the rehab protocol. So give yourself a break. Sometimes if you feel like you're declining, sometimes if you feel like your range of motion isn't improving, it's not because you're doing too little, it's probably because you're doing too much. So go ahead, remember it's going to take energy to heal. Give your body that respite. So of course, during the procedure, now different procedures, there's going to be different amounts of blood loss, but there is going to be a level of blood loss. Some patients are anemic before they go into surgery. If you're not at the level of requiring a blood transfusion, you are going to take 4, 6, 8 weeks to build back up your red blood cells, to build back up your energy levels, your iron stores. So be patient, but understand with the blood loss comes that rapid onset fatigue after surgery. The stress of surgery, not just the physical stress of the actual surgery itself, but the stress of getting ready for surgery, coordinating the household, figuring out who's going to drive you to therapy, figuring out how you're going to take care of yourself, how you're going to bathe and dress and groom and do all of those things, who's going to handle meals, who's going to take care of the pets in the family. All of that is stressful. All of that stress wears on you. And once you're past the actual surgical date, a lot of times we see this like offloading, we see this depression that kicks in, this emotional swing, which is completely normal, completely common, but it does affect your energy level. And that's my next topic is mood. depression, anxiety, all of the things that are associated with a major surgical procedure like this. These need to be recognized, whether there's a treatment for this or not, whether it's something that you're going to go through and come out on the other end. What's most important here is that you acknowledge that you're feeling these emotional changes, these swings, that you are working on doing what you need to take care of yourself, to allow yourself the time to recuperate and recover, and to know that you have a support system around you that will give you the support that you need. And then finally, the last component here, I think this is number 8, is the medication. You know, the medication, whether it be a pain medication or narcotic, or whether it be some other form of medication, it is going to have a physical toll on your body. It is going to wear you out. It's going to make you fatigued. While there are some medications that tend to have a stimulating effect, most of the time when I see patients following a total knee or a total hip replacement, the medications they're on tends to be more of a depressant than a stimulant, and with that, they just fatigue so quickly. So all I can say is I've been doing this a very long time. I've been fortunate enough to see hundreds and hundreds of patients following joint replacement surgery. While I myself would never pretend that I know what you're going through, the best that I can do is share the experience of others. And I could tell you that it's totally normal to feel fatigue getting up and walking 10 feet across the room. It's okay to feel like you have to take a break after that. It's okay to feel like you're wiped out after that. But each time you do it, it does get better. Guys, thank you so much for watching. Subscribe to the channel, and I'll catch you on the next video.